Thank you, everybody, for taking some time, and welcome to the Brothers in Public Health Strategic Objectives Focus Group. This is our second one of the year, so we really do appreciate y'all just taking the time again to be here in community with us. We have a hopefully quick set of slides that we're going to be overviewing for you all that just kind of goes through our strategic objectives. This is really meant to kind of be our strategic plan for 2024 through 2025. And the intent and why we're doing this is just to make sure that before we continue to formalize, crowdsource, and grow our organization, we're making sure we're getting the feedback from brothers like you all that are in the field that have, expressed interest in being part of the mission and the vision of Brothers in Public Health in some way. So again, just really appreciate y'all being here. And I'm operating off two computers, so bear with me as I navigate advancing the slides. But agenda for the day. So we'll spend some quick time just with welcome and introductions. Definitely want to hear where y'all from, what you do, who you are. Then we'll spend a little bit of time, the executive board, excuse me, going through our strategic objective review and just sharing all the things that we plan to do. And then hopefully have most of the time for question and answers and a discussion as well. So that is going to be that. If you have anything in the chat, any questions come up, feel free to put them in there while we're going through the respective slides. We'll try to pop off and address anything we can there. But just in terms of looking ahead and actually looking back a little bit, we had our first focus group in January of this year. You guys represent the second one. So again, really appreciate that. I have to say everything is being recorded right now. So hopefully y'all are okay with that. For the folks that missed this session, we're going to send it out via unlisted link on YouTube, but also we'll be capturing you all's feedback and sharing that across our platforms as we begin to really kind of put the bow on our strategic plan. Be on the lookout for a membership launch or membership invite. This is a question that we get a lot, like how people can get involved and really become a part of the organization. We had some plans to do this a little bit earlier, but have kind of paused for a little bit. Omari, I was actually, not to put you on the spot, I don't know if you wanted to speak to just a little bit kind of what a high level plan looks like for membership.
Yeah, definitely put me on the spot. But at high level, I think we've seen from the reaction of people like yourselves on this call today that there is a need for a community of brothers in public health or brothers interested in public health just to have that community, have that accountability, have the mentorship. So these are all things that we are thinking about, and we will be launching this soon, as Winston said, and would love feedback today if there are things that you would want in a membership and different things like that. But more to come, and very grateful for you all coming in today and like being a part of this and just sharing your insights and your thoughts because we are nothing without you all. So appreciate you all.
Absolutely appreciate you, bro. And then rounding out that, or excuse me, going into the second quarter, we will be having an inaugural Brothers in Public Health Town Hall. So this is going to be towards the end of April. So be on the lookout for that in more details, but we'll start promoting that probably sometime during National Public Health Week, which is the first week of April. So with that being said, just a quick round of introductions. We would love to hear from you all. We had, I think, like 8 or 9 people join us the first session. And so, it's always kind of a chill, very informal environment. And I can just go down the list if that's cool. Just call on y'all and then share your name, where you're from, and then what makes you be here today. Why is your interest in Brothers in Public Health? So, first one I'm seeing is Donnie.
Donnie, he, him pronouns. Wonderful being here. Right now I'm in Houston, Texas, but my work is based in Minnesota. I'm a HIV prevention educator and care linkage specialist is my title, but it's mostly HIV prevention and education. And why Brothers of Public Health? I saw the uh, I guess advertisement on Instagram, and there's just no brothers in kind of the world I work in. Yeah, unfortunately. So, I was just interested. and thought I'd stop in and see what you guys got going on. And yeah, like I said, I'm thankful for being there.
Appreciate you, Donnie. Thanks, bro.
Evidently, bro.
All right. Luis, we know you're driving.
Actually, I'm pulling over right now to my house. So,
Hey,
right on time. What's good, everybody? My name is Luis. I currently work as a prep medical coordinator, very similar to Donnie as well. So, I'm located here in the Philadelphia, South Jersey area. Been working in HIV prevention for going on 2 years now. Recently, I graduated from Penn State, focusing on health policy administration. So I'm still kind of indecisive if I want to go back for an MPH or MHA. So similar to what you mentioned earlier, just looking for mentorship, meet new people, especially since I found it on LinkedIn. So I want to keep, taking advantage of the resources and the community, which is very important to me.
appreciate you, Luis. And I'm from Philly, so gotta shout you out.
Yeah,
We got
you're,
Saquon back home, you know what I'm saying? So we about to do some
yeah,
nice things. Looking forward to it.
looking good.
Yes, sir. Okay. Next up, Malcolm Clay.
Hello, my name is Malcolm. He, him. I am a community health worker out of Washington State, not DC. I am in the process of looking for grad schools. I been graduated for about 2 years, did a bunch of research and stuff like that. And violence prevention, mental health, career development, all that fun jazz. One of my mentors I collaborated with sent me this on LinkedIn, so I thought I'd come and check it out and see how I could help.
Appreciate you, bro. Thank you for being here. And then Malcolm Wilson.
Hey, what's going on, everybody? My name is Malcolm Wilson. I'm from Prince George's County, Maryland. Um, Y Brothers in Public Health. Wait, who else from PG?
Right here, man.
Same here, same here.
Okay, that's what's up. That's what's up.
In the building.
That's what's up. We definitely deep in here. Yes, I'm from PG County, Maryland. I actually got my undergrad degree in behavioral and community health from University of Maryland, College Park. And then I moved out to Arizona and got my master's. So I have an MPH in applied epidemiology from the University of Arizona. So the reason I really was interested in this organization, one, you guys' promotion is on point because I was just scrolling through IG Reels and you guys just popped up for no reason. So I thought that was really cool. And I decided to see what you guys are about. I'm definitely looking for either mentorship or to mentor any young African Americans in public health because there aren't many people who look like us in this space, especially as you continue to elevate yourself. You see that the space starts to look wider and wider, if we're being honest. So I definitely want to encourage more people who look like us to get involved because it's important. So yeah, that's why I'm interested in this organization.
Appreciate you, bro. You
So
definitely very aligned with where we want to go. And yeah, it's a very candid space. We often joke that for everybody's first APHA meeting, we saw a bunch of white women and we were like, oh, we know this is what public health look like.
man,
So
I it's crazy because in undergrad, I I saw in my public health classes there were a few people who looked like me, but like as I went to get my master's and I would attend conferences and stuff like that, I'm like, wow, it's literally just me. It's
yeah.
just me. So it took some getting used to.
No, that is a fact, and that's why we are here to hopefully change. All right, e-board in the direction of or guessing the flow of how we appear on the screen. Want to do some quick introductions.
All right. Hey everyone, my name is Miles Davenport. Also obviously from PG County, Maryland. Born and raised in the DMV area. It's funny, Malcolm, that you're in Phoenix because I actually had lived in Phoenix for about 11 months before coming back to complete my master's at UMD. I got my bachelor's and my master's from UMD. So
Oh, that's
interesting.
what's up. That's
Yeah.
what's up. No, I moved back home in 2022 after I got my master's, but I was out there for 2 years.
Okay. Gotcha.
Yeah.
Gotcha. I would love to connect with you later and learn more about your experiences there, but
if Phoenix is anything like what it was when I was there, I'm sure you got stories to tell. But yeah, so I'm currently working as an epidemiologist at the Office of the Chief Medical Examiner in Washington, D.C. And I've been doing that for almost 2 years now. Um, I'm the president, co-founder, one of the co-founders of Brothers in Public Health, and just really excited to get this movement rolling for the rest of the year. And some of my public health interests include data science, data analytics, um, and stuff like that. So happy to connect with each and every one of you. I'll pass it off to Aaron.
Hey everyone, I'm Aaron Carpenter. I'm the VP of Research and Advocacy. I'm from Burlington, North Carolina, rural North Carolina. I currently work as a policy associate at the Robert Wood Johnson Foundation and also in the practicum office at UNC Chapel Hill's School of Public Health. Sorry, also, I'm a little beat today. I've been in like an all-day work event where we were scenario planning for the election, and yeah, crazy potential with the election. So just say that. And then why Brothers in Public Health, I think kind of similar to what many of you said, I think the more I started to explore the public health space, the more I realized that one, there's not a lot of Black men, but two, there's just not a lot of acknowledgement of that either, which is really odd to me. And then even more broadly, there's not a lot of men of color, and that's not acknowledged either. Yet we oftentimes have some of the worst health outcomes community to community. So I just see fundamental gaps in like who's doing the work and who they're doing the work for. And I think that that really drives my not even just my passion, like the desire to not just work in this space, but be in this space. Um, I think mentorship is critical. And I think for so long, I can't even, I think about us and our generation and how much mentorship we have access to and how limited that is. I can't even imagine what it was like for men of color who entered this field 10 years ago, 15 years ago, 20 years ago. So I think I really want to make sure that we all are paving the way for more men of color to live healthier lives, but also be in this field so that we have our voices heard. And I will pass it to Amari.
Good evening, everyone. Amari Richards here. I am a VP of community, is actually community, not community engagement. We'll get that changed, but VP of Community of Brothers in Public Health. Originally from Trinidad and Tobago. Lived there most of my life. Did my last 2 years of high school in the Middle East in a country called the Sultanate of Oman. Then did all my like higher education schooling in Florida, University of Tampa for my bachelor's degree, Masters of Public Health at University of Florida. Went to the other side of the country in Alaska for a fellowship for 14 months, and now I live in Winston-Salem, North Carolina, where I work as a health improvement program officer for the Cape Reynolds Charitable Trust, a 75-year-old health foundation working to improve the health and quality of life of financially disadvantaged North Carolinians. Also, I'm the founder and CEO of the Public Health Millennial online platform, helping public health people learn, navigate, and transform their public health careers. Just in my life, and I guess through the things that I do, I'm like all things public health and like all things Black health. So there's a natural fit here, as well as other men of color, other marginalized communities, other oppressed and disinvested peoples. So when these group of guys came together and we had the idea, it was something that was easy to say yes to, and looking to continue to develop the drive to do all the things that we need to do to ensure that there's representation of men of color in the field and men of color in being change agents in the communities. So looking forward to connecting with you all. Once again, thank you all for being here, and I'll pass it across to Winston.
Yeah, appreciate you, bro. Good evening, everyone. Winston Wellington Wright, originally from Philly. As for the organization, I serve as vice president of organizational development. So really just kind of helping us get the ground running and put the foundations together so we can be, strong nonprofit. But a lot of thanks to Miles for being the person that had the vision for this. In my day job, I serve as program manager of diversity, equity, inclusion at BJC Healthcare, which is one of the largest healthcare systems in the United States. We serve Missouri, Illinois, and Kansas. Got my MPH from Morehouse School of Medicine, so actually was really lucky to be around a bunch of brothers on my public health journey. But definitely, as I transitioned into my professional career, I did a fellowship, an administrative fellowship, as I concentrated in hospital administration at Morehouse. Yeah, definitely just saw the need for more folks like us, and I think that there's a lot of power in us being together as young professionals in Philly, as we say, young bulls that's really, dedicated to just changing the world and wanting to see the world how we see it. And I think even within public health spaces, there really still isn't a voice for the streets. And that's just how I feel. So I'm very passionate about trying to bring that lens to the industry. So that's me, and I'll pass it on to Savion.
Sir, last but not least, so I'm Savion Thompson. I am currently the intern for Brothers in Public Health. I am born and raised in North Carolina. I'm currently residing in Boston, Massachusetts at Northeastern University, finishing up my undergrad degree of my bachelor's in science in health science and business administration, concentrating in healthcare management and consulting. I'm also working towards graduating with my master's in public health next year. So outside of Brothers in Public Health, I'm also a research intern for the Institute of Health Equity and Social Justice, focusing on research for first-year students coming to college. And then why Brothers in Public Health? So for me, when I joined the MPH program, I really knew that I wanted to learn about minority populations and people of color and all the issues that they had going on, and how I could address that specifically. I thought I was going to go into healthcare administration. Did my first job there. Was like, yeah, this isn't it. So, so I continued to go on with public health, and then when I was in part of the MPH program, I think I'm literally like one of 3 Black men that are part of this program, and like actually I'm pretty like think there might be 5 men of color in the program that I've noticed so far. And that really just didn't sit right with me, considering that it's our health that we're working with. So I really want to help make a difference with that.
All right. So this is the part. This is the main part. Strategic objectives. So before we roll into kind of how we have everything outlined, and again, appreciate y'all being here and introducing yourselves. Wanted to go over a little bit of our mission and our vision. So the mission is very simple: to increase representation of men of color in public health, to advance the field, culture, and awareness of public health in communities of color. There's a lot of great professional organizations that do work right, and have mixers and, retreats and things like that. But for us, the way we really approach this work is we're trying to bring more people up. We really want to be a more community-centered organization. So that is the mission. And then the vision is a world in which men of color are positive change agents for the health liberation of their communities. So, all of us relatively educated, had some kind of guidance, obviously, at some point in our lives, and, had an interest and a passion for healing our communities. And, there are other people out there at all stages of their life, young, old, that kind of have this interest as well. And just wanting to highlight something, the graph that you see on the right in the dark blue is literally everyone who is not a man of color, um that in terms of public health graduates with their MPH in 2022. So altogether, it's like less than 10%. It's like 9 point something percent. But when we looked at these numbers initially, we were actually kind of like, damn, we didn't know, we know we don't see ourselves, but we didn't know that the numbers actually backed this up. And even today, we dropped a post on our social media pages that just highlighted that the actual percentage of Black men and Hispanic men in particularly that are entering college is actually decreasing, and it's been decreasing since the pandemic. So while we continue to move up in our careers and get more exposure and advance, there's actually not a lot of people coming from behind us. So that is, kind of our mission and our vision, and really what we're looking to bring to the space, but also bring to our communities. So in terms of our strategic objectives, we have four main ones that, again, that will focus kind of as our main focus points for 2024 and 2025. So the first is just building awareness, which I'll cover and get into. The second is community impact, which Amari will touch on and speak on. The third is research and advocacy, which Aaron will cover. And the fourth is development, or AKA fundraising, try and get some of that money on, that Miles will cover. So in terms of building awareness, when we talk about this from a strategic standpoint, there are a couple of different things that we really are focusing on. And if you all are paying attention to our content right now, we really are using content creation as a way to do this. But focusing on health inequities among men of color, many of you spoke to that's obviously why we do the work that we do. And within public health anyway, that is the focus. Oftentimes, communities of color, most vulnerable populations. The second, the public health educational pathway. So it's dope just to have people at different spaces, even, as we're all young or emerging professionals, and really just assisting each other and providing support to each other for how you really get the best of your educational opportunities and resources, and also how you can carve out a pathway that really aligns with your interests, your passion, and what you want to do. The third is career opportunities in public health, right? It can be kind of hard to find what you feel like is that real dream job, that you feel fulfilled, that you're getting, the exposure to the industry, and you're actually able to have that impact. And then the last is just, really bringing awareness or building awareness on Brothers in Public Health as a resource and as a support network. So this is kind of like the feedback loop when it comes to building awareness that we want to do. And again, all of the work that we'll be doing regarding this particular objective will fall into these four buckets.
I got community impact up next. And I think both of these kind of overlap in a lot of ways, especially in this first year of doing work. Because when I outline what we're doing, it really just highlights that we are trying to raise awareness, both around us as an organization, Brothers in Public Health as a nonprofit doing this work, as well as ensuring that as Winston was talking about, ensuring that everyone knows that this is an issue and this is why we are coming together to solve the issue, to get more men of color into public health. And as we say that, one of the main things we want to focus on and we've been thinking about is just getting speaking engagements. And many times we think about speaking engagements at master's programs, at undergrad programs, but we really want to be intentional, because I would imagine for myself, I only learned about public health when I was scraping and searching for things at age 20, 22 or something like that. And it wasn't something that intentionally came to me. And I think that is a shame, because there's so much power in the work that you can do in public health and the skill sets that you can gain from in public health. So we really want to just ensure that we are getting into high schools, into colleges and community colleges, and really open to other feedback in places where we should be talking about the work that we need to do to ensure that there is a pathway for men of color into public health. And one of the ways, as Winston was talking about, is the social media creation to share all the things. And just, if you have not followed us on social media, be sure to follow us on Instagram, LinkedIn. I think those are our main platforms right now, but we're definitely going to be very intentional in sharing out information, because we really want to be an organization that is part of shifting the narrative of what it means to be a man of color and what that means for community and health. And then we're also thinking about having local Brothers in Public Health chapters around the country. So that's something that we'll be figuring out probably later this year, and maybe launching some chapters later this year. But that would be kind of built off of the membership and the community that we're going to be starting soon. And then community workshops, really trying to build tangible skills for people, whether that is community members or whether that's people in public health. But we will love guidance and your thoughts and feedback to really ensure we're doing our best. But this first year is really about raising that awareness around what we are trying to do and like bring our name out as an organization doing this work.
So we see research and advocacy as a critical piece of representing men of color in public health and also furthering the health of men of color in the nation. So primary focuses, as it stands, and this is very open to, some adjustment as we seek out information from you all and from men of color across the nation. Healthcare access, healthcare education, so really healthcare literacy, employment, and also criminal justice reform. And so one of the things that will very much so fall under the domain of research and advocacy is policy advocacy. And as it stands, not only are men of color underrepresented in public health, they're very underrepresented in political spaces. So we very much so see ourselves potentially being a conduit for information as well as for some of the emerging legislation that could be either harmful or beneficial for men of color across the nation. Currently, my role at RWJF, again, is a policy associate. So I would say I have, I'm privy to some of the emerging trends within the policy landscape. So I really hope to utilize some of the contacts that I've made at RWJF as well as more so within just the policy making field. Outside of that, we oftentimes will use research from legacy researchers, right? So another thing we see ourselves doing is amplifying the voices of researchers who are men of color, who have historically been underfunded, who have historically not been looked to for information, even when that information is about communities of color. So there's a lot of opportunity for research, policy advocacy, but then more broadly, there will be a lot of overlaps with the work that, the other guys are doing. Specifically, I see with community, right? Because the advocacy work that we're going to do is going to be driven by what we hear from the chapters that we hold across the nation or regionally. So really excited to build out some of our research strategy and advocacy strategy, but also very excited also to, again, serve as a conduit for information to the broader field.
All right. And last but not least, our fourth strategic objective is development. So pretty much our three primary goals are to establish an operating capital fund. Also, in order to achieve one of our values of scholarship, we would love to develop a scholarship fund so that we can give back to our community and support our brothers in need to complete their educational journey. And also, we want to create a community impact fund. One of my biggest responsibilities as president, I'm a man of few words, but I do a lot of like the back end work as far as like making sure all of our processes are in order, that we have checks and balances in place. Is just to make sure that we have an operational budget so that we can achieve our goals. And that's just so that we can establish a sustainable and a diversified financial fund so that we can support the mission and the growth of Brothers in Public Health, while ensuring that we can remain stable and expand. So currently, the way that we are able to develop financially has been through donations. We've thankfully received a number of donations through some personal colleagues and some complete strangers through just making ourselves known through our online platforms. But of course, we're still looking to do more. And some ways of doing that is that we're exploring several different partnerships. We look to apply for grants, and also some of that capital will come through our membership strategy. So again, we're still in the phases of rolling out what that membership will look like. But just to give an idea, that's how we're able to sustain a financial um, status. We look to measure that quarterly, and of course that'll change over time. But we're really looking forward to working with uh, other partners throughout the year. So appreciate it.
All right. So that pretty much rounds us up, y'all. You know, we have four again primary objectives really going into this year. I think, you know, uh it's really like what we've been saying is we kind of want to build this kind of like a crowdsourcing vibe, right? So we really want to build this with the community, being able to incorporate feedback, having the initial members really be a part of it from the start. So I have a few just kind of, you know, questions, I guess, for y'all to react to. If you would like, these can kind of just be up here, or you can feel free and come off mute and ask us whatever y'all want to ask. This is the discussion point, so we can get into any conversation, hear any ideas that y'all have. So the floor is yours.
I think from the outside looking in, I can't really overstate how important a organization like this is. One of the things that stuck out to me, what you guys were talking about, is how we look around in our professional capacity and we see in some situations, um, there aren't a lot of people who look like us, and but we also are we thinking about bringing other people along with us? So what happens to like people after us? So I think that that's important as well. Like bringing along, like you guys talked about, you guys want to speak at high school, speaking engagements at high schools, community colleges. I think those things are extremely important. Just building the awareness of organizations like this, and not just organizations like this, but even the field of public health. Because specifically for me, I didn't even really know I wanted to go pre med. And then when I realized that I couldn't, I know a lot of y'all probably wanted to go pre med. And then for me personally, I came across organic chemistry and I had to switch my my career goals. So that's where I discovered public health. But that was already so late in the game. By that point, I was already, yeah, exactly, Winston. I was already 19 or 20. I was lucky enough to go to UMD. UMD has a very robust public health SPH. I know a few of you know about that. So, but there aren't a lot of people who are aware of like public health as a field and what you can actually do with it, especially people who look like us. So I think building awareness is probably the most important thing that you can do. And then also research and advocacy as well. I think that's very important. But yeah, I definitely think this organization is super important.
Malcolm, I appreciate you sharing that, bro, because you know, as you mentioned, that's a lot of us were shaking our heads like, yeah, like we all kind of had a similar idea. And it's like the intent is always to heal, help, support, serve our people. And for me, if it wasn't for like Morehouse coming to another HBCU I was at, like I would have never known about public health. I never heard about this before. And so to your point, like it's crazy how small it may be when you think about like, okay, we'll go give a 30-40 minute presentation at a high school, but just planting the seeds in people's like, you know, minds of like, nah, like this is a field you can go into, you can explore these kinds of topics, these kinds of issues, like it can help you uncover so much. I think that's the beauty that I've kind of seen in public health. And so that's something that we definitely want to focus on. And even outside of, you know, the organization will definitely be you know, putting together toolkits and kind of like, you know, just resources that y'all can use in y'all local areas to start doing that, right? Start identifying some of your schools and going back to that. So I definitely appreciate your feedback.
Yeah, I'm gonna follow that up a bit. One, I'm just incredibly taken by the level of expertise in this field. I have a very non-traditional background by which I came into public health. Um, and for me, it's very affirming to be looking at, brothers who have such a strong foothold in public health as an academic study, as something that has to be legitimized in that conversation in communities. Um, that's not something you come across a lot, right? Being able to go to Black men for knowledge about public health. That's not generally the conversations you're saying. So I am very impressed with that. I think the two things for me is one, I'm always asking, where did the art show up? Because though I do work in public health, I'm an artist first. And where much of public health is, or where much of health advocacy takes place, especially here in Houston, is through the arts. People come to public health and conversations about public health through the arts. So wondering where that shows up. And then the other thing too is wondering, especially just because of all who makes up the space as men, where it is you all plan to find yourselves in spaces, or we all plan to find ourselves in spaces where public health is being practiced in non-traditional means, often facilitated by women, by queer folks, by trans folks who are exercising public health in other ways, right? Through the arts, through other means of community engagement that isn't so much so talked about at a higher academic, capacity. Because, like you said, folks where public health matters and health disparities matters just don't get looked at. So conversations about rest, conversations about um, you know, healthcare for Black trans folks, conversations about all those other things just don't get discussed. So obviously people are working in those non-traditional means of practicing public health, through yoga, through all those things we don't really hear about. So wondering where as men you plan on finding space, sharing space, if that's a conversation at all, because that is where public health is being practiced, even though we may not qualify it as, kind of public health. So that's kind of my two things, aside from just affirming that the work here is needed, it's necessary, and I'm definitely honored to be sharing space by all means.
Thanks, Donnie. I think that's actually something that we discussed as a team previously. I think just the fact that public health is everywhere. It may not be, you might not have a fancy title as public health. You may not need a degree to work in a degree in public health, but just understanding that it's all interconnected is something that we want to make sure that everyone is aware of. So, you know, um, as an organization, we want to make sure that it is known that public health is everywhere. And I mean, if you want to pursue, public health as an academic, that's cool too. But we just want to make sure that everyone is aware that, or advocate for all these other allied spaces.
To add on to that, to the points that you brought up about the how interconnected and how like public health is everywhere, the first thing that came to mind when it came to the objectives of building awareness and community impact, just the part where language plays into that, specifically like different languages. Spanish is my first language. A lot of the patients that I work with eventually when it comes to like PrEP and prevention, et cetera, are also Spanish speaking. So eventually how can brothers in public health also be used as a platform to engage those who speak Spanish and also in public health and bridging those other communities? I think that's something that really came to mind with like social media, specifically plain language, because sometimes in English, things don't easily translate over to Spanish or to Mandarin or et cetera, et cetera. So just keeping that in mind when it comes to community impact and overall building awareness of the nonprofit and getting more people to come and support.
Luis, I appreciate so first of all, Donnie and Luis both appreciate your comments. Because they're definitely aligned with kind of like stuff that we've already talked about. Like, we want to be on the forefront. We want to be progressive and we want to be inclusive. Like those are just things that definitely are top of mind for us. And so, Luis, I'll address your point first, actually. So, our Hispanic Latino brothers, we've been thinking about y'all a lot. Like that's been like a core focus for us because we know like that's just another piece of the puzzle right behind us and all the statistics and some statistics, and some health inequities over us. Same thing with our American Indian brothers as well. So Miles and I will actually be giving a webinar at Charles Drew University, which is an HBCU medical school out in Cali. And that's we're gonna have a big chunk of folks who identify as Hispanic as a part of that audience. And so we trying to build out the West Coast as well and get some connects. And I'm just gonna kind of talk hypothetical here as we build out membership. So let's say you were to, come on as a member before we kind of launch our chapters, and we wanted to bring awareness to health inequities within Hispanic men for National Hispanic Heritage Month. Like we would lean on you, bro. Like, hey, like, make this real, make this post, like what we can collaborate on the statistics, and then like let's put you up, like, on our social media pages and highlight, not only like the things that you're trying to bring awareness to, but highlight yourself as an up and coming, young professional. And so just with the content, that's definitely something that, we're going to leverage in order to kind of build that awareness. So, stay on top of us for sure. But that's kind of how we see doing that in the first year. And then I'll also just let y'all know, because we don't have to kind of talk about this, but what's been an elephant in the room for us is that brothers in public health, when people hear that term, obviously people are going to think Black men, right? And like that's cool for us, because that is who we center. But it is called brothers in public health because we're being intentional about everybody who falls into that category. And we really feel strongly like that the power is going to be in all of us coming together. Obviously, having space, having the content, having the partnerships that can be specific, but like we all there. We all there to learn. And so honestly, if you have more folks in your network that you think, would be interested, please send them our social media pages, connect them with us, because that's also something that we have thought about. So I just appreciate that comment. Even drop in, I didn't, team, I don't know if we even thought about that, like drop in, certain posts in Spanish. That'd be dope, like, super dope. And then Donnie, to your point, I love you calling out the arts. That's definitely something that I don't know if we've specifically talked about, those non-traditional spaces, but I think that's where we would lean on an individual like yourself. Like, hey, like what are the organizations in a place like Houston, or even outside of Houston, where or Minneapolis, I believe, where you said you are. Based out of, where we could really start to create some of that partnership, and what does that look like. And it's definitely not lost on us for sure, in the LGBTQIA space, what that looks like, and how we really have to hold space for that as well, right? Some of y'all work in prep, prevention, and we know that there's still, unfortunately, I'm in Nashville right now, we know that there's still a lot of disparities in the deep South, just because of stigma, with some of our brothers that identify as gay, and just being able to actually get the services that they need because of that stigma. So y'all are definitely speaking of things that we're thinking about, and it really could just be as easy as like creating some content, partnering with things, and ensuring that we're locked in with y'all's network. So I appreciate those comments for real.
Very last thing. And it may have already been framed, but I think as a single parent, one thing that's interesting, I'm very interested in is organizations that support healthcare providers. And so how it is you plan on supporting the health of public health professionals, Black male public health professionals. Um, because I think that's a big thing that's like often missed, Even though we talk about it a lot, it's like, folks with help people need the most help. But if we're talking about that intersection of like comorbidities with Black folks, and especially with Black men, and then like, the stress of being a public health professional, a lot of that just kind of blows up. So it's definitely a big thing for me.
That's a great call out too. Yeah, stress is number one killer for for a lot of people.
Yeah,
That's
I
a
know
fact.
for us, thankfully, there's a lot of fatherhood groups coming up nowadays. I'm part of a black men's not locker, it's a black fatherhood group talking about like how to prevent like younger kids from being parents and like helping kids like navigate fatherhood if they have kids. So we do like a lot of like career development and like skills based stuff, which is nice. And then we've also been incorporating more into like consulting folks, so like working with health departments and behavioral health groups, more so for like wellness for like black men in workplace spaces, healthcare spaces and stuff like that. So definitely utilizing that. And then to your comment about the West Coast stuff and the chapters, I think that would be really nice because we don't have, at least in my version of the West, we don't have a lot of HBCU and Divine Nine groups and stuff like that up here. So definitely getting that those stories and those messaging up here because we have a big military base and military groups. So we have a lot of folks traveling from down south up here and they came from HBCUs and stuff like that, but we don't have like a lot of innate, chapters here and things like that. But there's a lot of folks, interested in learning about that. I know I didn't learn about HBCUs and public health until I interned at Morehouse by accident. So definitely learning about that and, spreading that on to different kids and stuff. And in terms of what you were talking about with the arts, there's a lot of community centers and third spaces we're trying to implement more. So like how can we get the messaging of public health in earlier spaces and getting it as a career in middle schools, high schools, colleges, for those who dropped out of colleges, for those who want to go straight to the workforce, for those who are recently incarcerated or those who just got out and stuff like that. There's still ways for them to be involved in that kind of life. So definitely a lot of good things coming out of it.
Yeah, for sure. Piggybacking off of what you said, Malcolm, I definitely think out of the four objectives that you guys have, building awareness, is probably seems like the most immediate and pressing one. Because when you talk about the field of public health, like it's so expansive. Like even just looking at you guys, prep advocates, epidemiologists, people you could work in policy, you can do anything with public health. Um, so I think, like Malcolm said, the earlier that you're aware of it as a career field and the directions you can go with it, um, that'll only not just grow the organization, but in turn, like it'll pay dividends for reducing health disparities. So I think it'll cause a cascading effect. The earlier that you can make people aware of what you can do with the field, the better off everyone will be.
Man, go ahead, Miles. You came off mute.
Oh, I was just gonna say I appreciate everyone's feedback, and I know we're coming short on time, but we're very thankful to have everyone on the call participate, provide feedback, and just share your experiences and your interest in wanting to be a part of Brothers of Public Health and kind of giving us some ideas on where we should move forward. Um, I wanted to formally let you all know that we're going to be extending a special invitation to you all and our we had a focus group back in January to join our global community. We're using Discord as our platform to allow individuals to connect with each other. So we wanted to invite you all to join the community as beta members, so you'll be able to chat with your fellow colleagues, connect with one another. And we kind of set it up where um, it'll show you like where you can find announcements from the organization, where you can introduce yourself, and pretty much just it's a space for you to be yourself, be free, and also share like your experiences working in public health. So it's actually going to be part of our membership uh, package. So as a beta member, you'll be able to access the Discord for free until July 1st. And that's when we plan to actually announce our paid membership plan. So, but up until then, you'll be able to test it out, interact, speak to one another, and give us feedback so that we can help, so that we can grow the network. So I'll be sure to share the link with you all a little bit later. Amari is sending me a note. Okay, so the price of the membership. I'm sure you all have questions. We have two tiers. One is student and the other is professional. I don't have the benefits of each with me right now to reference, but the student membership would be 45 with you might have to explain that, Winston.
Yeah.
But
Okay. So for the first year, what we want to do, just in terms of being equitable, is we want to make sure that students actually have the capacity to join something like this. So initially we were like, maybe we'll do, for free in the first year, and then after the first year, after we capture, students will move to $45. But we started off at a minimum of $5. So it's going to be like, in the first year, if you are currently a student, at least $5 for membership. But if you want to give more, you can. And then the following year, it'll be 45. And then for professionals, so everybody else, it would be 85 for the year.
so yeah, if anyone has questions, feel free to let us know. But we're gonna be sending you an invitation to join our Discord. And again, you'll be able to just we'll be probably the first few people in it, just so you know. But we look forward to building out with all you guys. So thank you.
Yeah, and I'll just add on to Miles' point again. Thank y'all for definitely coming. This was actually the feedback was a little bit different than the first focus group. So it was cool to be able to get more ideas just about like awareness, who we should be targeting, because we talked more about like structure and chapters and leadership and kind of that in the first one. So very cool. The five of us. Again, we are the e-board. We do this because we're passionate. We meet every Wednesday, and the Discord is gonna be, a relatively small community, right? Altogether it may be like 20 of us in there. So Luis, Donnie, y'all had some ideas. Like I would even go as far as to say we're open for collaboration. Like if y'all have things that y'all want to do, like I would definitely love to, start thinking about some of those things. Myself, Omari, and Savion are kind of the primary content creators on the team right now. But once we open up the Discord, y'all have access. Please feel free, to share those ideas and we can work. And then just have to state this, we really, in terms of like structure, chapters, identifying the other roles that we need for the organization, I would say that's just an ongoing process for us. So if you all think of anything or want to bring things to our attention, that is absolutely cool. But just give us a little bit of time to work through things. There are some bigger things that we haven't done. So, for example, don't necessarily have a board of directors yet or an advisory board. We're getting a lot of outreach from just real seasoned professionals and leaders in the public health space though, so we're confident that we have some folks, but just some more of those formal things about the structure we're still building out for the rest of the year. And then even ideas like a get together or a conference, obviously there will be APHA, but just we would love for y'all to maybe start thinking about some ideas like that as well. None of us get paid, so we all do this for free, just on top of our regular jobs. So yeah, so as Miles said, he'll send the invite to the Discord once we get everybody's names and contact information organized. We'll also be sending out these slides as well as a link to this recording. And Omari, Aaron, Savion, anything else I'm forgetting or we're not mentioning before we jump off? Or anything else y'all want to add or say?
I mean, I'd say I really appreciate you all coming together with us to talk about the issues that are affecting all of us, and then also throwing around some ideas like this is where it all happens, really. Like when we're saying we want to be grassroots, these are the types of conversations we're going to need to be having. So really appreciate you all being in community with us and yeah, talking with us.
All right, gang. We appreciate y'all. Wish y'all a great rest of the evening.
Thank you, guys.
All right, everyone. Well, catch y'all next time. Have a good night.
Thank you.
Thanks for joining.